Welcome to my YouTube channel. Those ones who subscribed, thanks for the subscriptions. And those ones who have not subscribed yet, subscribe, put on a notification, and we will continue to enjoy as we learn. Today, we are going to look at chlorphenamine, the drug you normally call piriton. Piriton, some people abuse it and use it as a sleeping pill, but that is not its role. It's not a sleeping pill. Chlorphenamine falls under a category of drugs we call antihistamines. What do these drugs do? What do these drugs treat? These drugs are there basically to treat what we call allergic reactions. And these allergic reactions might include urticaria. We can have skin rash. We can have itching eyes. We can have hay fever. All those allergic reactions, we use this drug to treat them. It falls under a class of drug we call first generation H1 receptor blockers. So, chlorphenamine, what is its mechanism of action? Before we go to the mechanism of action, let us look at the groups of people who are not supposed to take this kind of drug. People who have all the contraindications of the drug now. People who have hypertension, high blood pressure, they are not supposed to take this drug. People who have what we call closed angle glaucoma, that is a defect in the eye. It's the condition of the eyes. People who have severe urinary bladder blockage, and they have urine retention, they are not meant to take this drug, piriton or chlorphenamine, because of its side effects and strong working effects. We are going to look at, there are other classes of people, but basically those are the people, and those people who have overactive thyroid gland, they are not also supposed to take this kind of drug. Now we are going to look at the mechanism of action of this drug. How does it work? So it is there in pills, mostly in pills. How does this drug work? This drug, when you take this pill, it's going to enter into your stomach, it's going to enter your intestines, it's going to be absorbed, because it is well absorbed, and it crosses the blood-brain barrier. So it is highly absorbed. When it enters your system, it's going to enter your blood. It's going to be transported all over your body. When it is transported, what does it going to do? It's going to bind to all H1 receptors for histamine. You know, in this case, we are targeting histamine as the major cause of allergic reactions. So it is going to bind on all H1 receptors. Histamine has H1, H2, H3, and H4 receptors. But this drug is targeting H1 receptors basically. So it's going to bind on these receptors, inhibiting the histamine from binding to these receptors. So once the histamine does not bind to these receptors, the receptors are not going to fire impulses. These nerves are going to be blocked. So the allergic reaction will be cut off, and there will be no further reactions. What are the side effects of this drug? Since this drug has the ability to cross the blood-brain barrier, it is going to cross to your brain. It is going to cause what we call a sedative effect. By sedating, I mean it's going to bring dizziness. You're going to feel drowsy and you sleep off. That's why many people abuse it and use it as a sleeping pill because of its potential of crossing the blood-brain barrier and causes sedative effects. So people use it as a sleeping pill. It is a side effect of these drugs, not the effect of the drug. It can cause dry mouth, it can cause nausea, it can cause headache in some people. So we shall have to stop misusing the drug, taking it as a sleeping pill. Its function, it's an allergic drug which targets the histamine receptors, that H1 histamine receptors. So it is an antihistamine drug, not a sleeping pill. We should correct that. So we have seen the categories of people who are not supposed to take this drug.